Hello and welcome back to my channel, Dr. Magnesium, with myself, Dr. Lee Keegan. And today we're just going to be doing a short video on the effects of UPF on the bowel and the ability of the bowel to absorb food and fluids. So we'll break this video down into a few different sections. So first we'll start off by talking about the anatomy of the gut, or we'll talk about the whole GI tract. So the GI tract starts off, or the gastrointestinal tract, starts off in the mouth and ends up eventually in the anus. So we start off the process by chewing food. Saliva is mixed onto the food, which is an enzyme which starts to break the foods down. We then swallow from the mouth into the food pipe, which is the esophagus. Food's then squeezed into the stomach, where it's churned up and mixed with acid to continue with that the breakdown of the chemical breakdown of the food. Food's then turned into a soup-like consistency and enters the small bowel, where a lot of the nutrients are initially absorbed. Then goes from the small bowel into the large bowel, where the rest of the nutrients are absorbed and a lot of the fluids are absorbed. It's then formed into feces or stool and is passed out of the anus into the toilet pan. So within the small bowel and the large bowel as well, in order to increase the surface area for absorption, it's not just a pipe or a tube. There's loads and loads of infolds or villi or microvilli or crypts, and the aim of these infolds is to increase the overall surface area to allow absorption of fluids and nutrients back into the body, so that we can take these nutrients in and we can condense and firm up the waste product, which is the stool. And this is where Dr. Montero first noticed an issue with patients who were overweight. They were coming in malnourished, which we'll go on to a little bit further in a moment. But this is what started the whole process of UPFs off. So within the gut, we've talked about the infolds, which increase the surface area, but in order to aid absorption as well, we have a lot of bacteria within the gut, which is called the gut microbiome, which is all the fungi and bacteria within the gut itself. This aids in absorption by breaking down the fibers and such within the diet, within the food itself. And you may have heard this termed as good bacteria. So this good bacteria aids with digestion of food. The issue comes from when we eat ultra processed foods. It's toxic, and the toxic effect of the foods can cause inflammation of the bowel itself, the surface area of the bowel, but it can also kill off the microbiome. And when this microbiome is gone, we then get colonized by bad bacteria, which is bacteria that's not normally within the gut, which can then cause different issues. It can cause further inflammation of the bowel itself directly by the toxins that are released in the waste products, or it can partially digest food or inefficiently digest food, which causes its own issues. The inflammation within the bowel is problematic for a couple of different ways. So the first issue is that the inflammation of the surface layer closes off these infolds, and once the infolds are closed off, we lose a lot of the surface area for absorption of fluids and nutrients within the bowel. So firstly, this is going back to what we've just said about Dr. Montero. This is where he noticed patients who were obese and ate a diet high in UPFs were coming in malnourished, and the reason for that was they had this chronic inflammation of the bowel, which stopped absorption of certain nutrients across the surface area of the bowel and back into the blood, and which was eventually, the nutrients were eventually being passed out into the feces. So this was the first issue. We're getting malabsorption, but also it causes inflammation chronically over a chronic period of time, I should say, causes a change to the structure of the bowel and causes chronic issues with the bowel, which can eventually lead to inflammatory bowel disease and cancers, which is why ultra processed foods, or UPFs, are linked with cancers and autoimmune processes such as inflammatory bowel disease. But also, that's not only the issue, it also causes a squeezing almost of the receptors within the bowel that feed back to the brain and tell us when we're full. So when the bowel is stretched initially, when food enters the bowel, We have receptors which trigger and send a signal up to the brain telling us that we're full and to stop eating or to stop feeling hungry. The problem is, however, when we get this chronic inflammation, they squeeze these receptors and stop them signaling, sending these messages back, so we never feel full. So this is another part of the problem of why we gain weight when we eat a diet high in UPFs. It's because we never feel full. Them receptors are being switched off, so we're constantly hungry. We also become malnourished because we're not absorbing that fluid and the nutrients back into the blood from the bowel, and we have chronic issues with loose stool, secondary to the fact that we're passing out a lot of water. We also then get the chronic inflammatory problems with inflammatory bowel diseases and cancers. So that's just a quick overview of the issues with the bowel from ultra processed foods. I hope you found that useful. Again, if you've got any questions, just send me messages or just comment on the videos. If you like these videos, please subscribe to my channel and share away to get the message out there. Thank you for watching again, and I hope to see you all soon. Thank you. Bye.